Tonight, a crowd rallied for school workers who haven't reached a contract agreement with Shoreline schools. Parents and teachers joined members of the Shoreline Education Support Personnel Association outside the Shoreline Center. CESPA workers include nurses, security monitors, crossing guards, and office staff. They say they're fighting for more face time with students.
The district is wanting to cut some days from certain groups that's going to cause them to lose face time with the students. For instance, nurses and library techs, security monitors, and behavior techs.
The next mediation session is scheduled for a week from Thursday.
Well, we are currently fighting for our contract. Our contract was up on August 31st, and we've been trying to settle the contract. The district has decided to call in a mediator, which is slowing progress down, and we are fighting to keep student services alive in Shoreline. So 3 years ago, we were in contract negotiations, and the district was in the red. We took cuts at that time, froze our salaries. Now the district is $10 million to the good. The administrators all have gotten their raises, and they're refusing to raise any of our wages. Well, Shoreline schools started cutting years ago and got in the black, and which is wonderful for the Shoreline district, but they have the money now to support these services, and they need to continue them. Well, we don't have a job action planned at this time, but the members are getting very frustrated, so we don't know what they're going to do in the future. We have great support here in the Shoreline area as far as our teachers and our community members, and they understand how important it is for the district not to cut student services. Shoreline is known for its excellence in the schools, and that's what we want to keep. Just that the parents in the community need to know that student services is the most important thing that we're here for. We're in the classrooms with the kids. We're the front lines that the secretary sees it the first time they come in the office. We're the security guards in the high schools and middle school. We're the nurses in every school in the district, which is a model that we like to keep. We work side by side with the teachers, and it's important work we do, and that's why we want to be there to support and teach our students.
Right now, tonight, it means that we really want the contract settled. It's just kind of unconscionable that they're working without a contract right now for so little money. I mean, the total amount that they're in negotiation for is $66,000. The administrators took $60,000 in salary adjustments this year already. I mean, between the superintendent and the assistant superintendent's salary raises could have paid for my library aide's entire salary. That's you can understand why we don't understand why it can't be settled. Right now, we're open from day one to the end of school. So it used to be in Shoreline that we would not be open for 2 weeks before school started, and we would quit 2 weeks early because we had to get inventory done, we had to get things back, we had we do not just book inventory, but we do the inventory for all the equipment in the entire school. So all of that has to be adjusted and cared for, and if those days are gone at the end of school, because we don't really want to encourage our employees to work without any salary at all, that means that we'd have to cut back on days. And to kids, that's key. There are just so many employees that are being cut back that it just raises a whole lot of questions. It's not one-sided. It's not simple, really, because it's the fact that a lot of the CESPA staff are being cut back in terms of hours to the point where they're under 4 hours, and 4 hours is the magical number for medical. And the district says they're not doing that. But when you look around and see what appears to be a conscious effort to cut those employees back, it kind of stinks of wanting to cut back one of the most expensive parts of a staff member, and that's benefits.
Services. We're trying to understand why our district won't settle our contract, and nurses are most concerned about the services that students have that relate to their safety in school. The district is asking us to do a gargantuan amount of work in 1 or 2 days in order to get our students ready for school. And those are the students that are most at risk. Those are our kids who have life-threatening conditions, which according to the state of Washington by the law, it's called a WAC, we're required to have those students have a plan of care in place before school starts, to have all the supplies needed, to have written orders for those students, to have spoken to their teachers, and to have instructed their teachers about the general concerns of that student so that they'll know, what do I need to do to take care of this student? So, and we can't do that in one day. The expectation for me, if the district got what contract they'd like to have, would be that I would be in my school one day before school started. And it takes me at least, I've been doing this for 15 years, it takes me at least 5 to 7 days to do that, and they want to squish that down to one. So it is in essence changing the model of our nursing services right at a time when the last 10 years, nursing services, both the volume and the range of the things that these good nurses have to do to get ready for students and to continue to be ready to take care of them has changed and increased just amazingly. 15 years ago, we didn't have a kid who was on a ventilator at school. We didn't have a child who needed to be suctioned, every few hours during the day. And now we have much more serious students with serious medical conditions to take care of. And we're being asked to do that all in less and less and less time. The reality, or that what they really ought to be doing, is giving us more days because the acuity of our kids has increased.
Students first! Students first! Students first!
The reality would be is that I wouldn't be available for their student when an emergency came up. Because I might be sequestered away doing paperwork. Because in order to do the paperwork that I have to do for the state laws and to do it according to nursing standards, which as a nurse, I can't just do what the district says I need to do. I also need to follow nursing guidelines and nursing expectations. And so if I don't have any time to do that in extra days, on non-student days and on a few days before and after the school lets out for summers and beginning of the summer and the end of the year, if I don't have the time to do that, then I'm going to have to shut my door and not see those students. And somebody else is going to have to see them and decide what's important and what's not important and when to call a parent. And nobody else can do that as well as a nurse can. And especially when our students are, have serious needs and serious health concerns.